Hi everyone, and welcome once again to my YouTube channel. So in this video I'm going to be covering hard pie to my meal, 5 nursing process. You have to know them, okay? Hard pie. So I'm going to start. If you have watched my video on objective subjective data, the assessment part will be a lot easier for you because that is exactly what I covered in that video. But I will repeat it because for ADPIE, you have to start by gathering information, gathering data from your patient. You're gathering all this data. Ma'am, how are you doing today? Oh, I'm fine. What brought you here today? I'm here because I'm having a headache. I'm paying a lot. I feel like I'm gonna faint. I have dry mouth. I have excessive thirst. Every information you gathered, those are your assessments. In assessment phase, you are gathering information. You are gathering information, you are putting one or two together, okay, to know what is actually going on with this patient. Now, you've gathered all your assessment. The next thing is to do what? Diagnose this patient. Let me clarify that the onset diagnosis are only done by medical professionals. So, your next step is your nursing diagnosis. What are the health-related issues with this patient? Your nursing diagnosis based on what the medical professionals has established, you already know. Let's say this patient is hyperglycemic. What do I mean by hyperglycemia? Too much of glucose, sugar in your body system. Now, the next thing to do is to plan. You already know that this patient have diabetic. As a nurse, what's your plan? Your plan is that within 24 hours of stay, this patient glucose will come back to normal. Let me clarify that normal blood glucose is from 70 to, some say 120, some 130. It depends on what your textbook says. So you're following your school own, please. All right? And it varies. So for nursing diagnosis, what do we do in nursing diagnosis? Nursing diagnosis is also your goal. As a nurse, you already got all your assessment, right? And you already have your nursing diagnosis. Okay, what is going on in this patient? As first of all, the doctor has diagnosed this patient. The onset diagnosis has been done by the doctor. He already confirmed this patient is hyperglycemic. They've checked the A1C. They already have their reports. The glucose level is too high. Let me say, normal glucose level can be from 70 to 130. It's different for female and male though. So you have to follow your school textbook, okay? So now that nursing diagnosis has been made, now you already have your diagnosis. What are your goals? As a nurse, you have to have a goal. And you have long-term goal, you have short-term goal. For your goal should be that, okay, within 24 hours of admission, I said 24 hours, within 8 hours, 5 hours, or 5 to 8 hours of admission, this patient should be able to, this patient blood glucose should be able to fall within the normal range. You can say maybe be at the range, or maybe when you earlier checked, the glucose level is like 190. Your goal, remember, must be achievable, must be measurable, and must be a realistic goal. So for a patient that has just been admitted, if you say this patient in the next 1 hour, the glucose level will have dropped to 70, you are lying. It's not going to work. I know you'll give insulin, and we'll talk about insulin later on. That's another topic entirely for another day. Short acting, long acting, your SABA, your LABA. But that's not the topic for here. Your goal must be measurable. Your goal must be realistic. Okay? This phase is between patients and nurse now. You guys having a communication that, ma'am, I'm really here to help you and I want you to get better. We both know what your diagnosis is right now, which is too much glucose in your blood, hyperglycemia, and we are both going to work together to make things better, okay? And I believe for me, my goal is that within the next 2 to 3 hours, within the next 5 to 6 hours, your glucose level should drop from that high range to at least almost a normal range. That's your goal. You are having that, you have to have that plan. And your long-term goal can be in the next 24 hours, your glucose level should be within normal. That can be your long-term goal. Another long-term goal that can be in the next 48 hours, your patients will be able to demonstrate, will be able to check their own glucose level. That can be another long-term goal, okay? Which is possible because recently I have a friend that I just taught on how to check his own glucose. Trust me, 24 hours later, he was able to demonstrate that thing. He called me the next morning in 24 hours and tell me, oh, this is what my glucose level is this morning. You see what I mean? So your goal must be achievable and must be measurable and realistic. I will emphasize on that because people fail due to the fact that they're trying to make things look right. Oh, in the next 1 hour, in the next 30 minutes, my patient will be able to verbalize comfort and the glucose level will decrease from 190 to 70. Don't deceive yourself, okay? Don't practice that. Be real to yourself, all right? So that is the planning phase. Now, to the implementation phase. This is when you put all this treatment to actions. You already plan that, in the next 24 hours, I want my patient to be in a stable state. Now, in your implementation phase, that is when you carry out the actions. That is when the treatment gets into actions. If the doctor said, okay, give insulin, they might give you sliding scale sometimes, like if this patient glucose is from 201 to 250, give 2 units. That what they are saying there is, if you check this patient glucose level and you see that, oh, it's within 201, this patient had 209 or 204 or 203 to 250, you are giving 2 units of insulin. Remember, I said I'm still going to cover insulin topics, so stay tuned on that. All right? So that's that for implementation. In that phase, that is the phase you are teaching. You're telling them, ma'am, these are the 3 P's you have to pay attention to as a diabetic patient. Polyuria, which is excessive pain. Polydipsia, which is excessive thirst. Polyphagia, excessive hunger. If you start to feel hunger unnecessarily, you're thirsty every minute, and you're paying a lot, please see your doctor. Those 3 P's, those 3 signs, they are telling you something, okay? Or maybe when your blood glucose is low, you feel so lightheaded, you feel weak, you're feeling tired. Those are the stage that you start to teach your patient. Ma'am, when you start to feel this, check your glucose. Something is not right. And if you check your interventions as you've been taught, this is what you do. These are the things you do. Okay, avoid skipping meals. Avoid skipping your medications. Be compliant with your medication. Take it as at when due. Things like that. All right? So that's what you're teaching in that phase. That's your teaching phase. That's when you're implementing all the treatments. If your sugar is too low, please take something sugary like orange juice. Take candy. Take anything to spike it up. Not something that will take it to heaven. No. Don't misquote me, okay? So, because we have diabetic ketoacidosis too, that's another topic for another day, okay? We're still dealing with ADPIE. So in your ADPIE process, what you're doing in implementing phase, you're teaching, okay? You're telling them the kind of meal to eat in order to have a good glucose level, all right? And now the last phase is evaluation. Remember, I told you, I taught even my mom. I taught my friend on how to check glucose, and in 24 hours, he was able to call me and be like, oh, my glucose this morning is this, my glucose this morning is that. So in that phase, that is when you get a return demonstration. If your patient in 24 hours of admission or 48 hours of admission is able to demonstrate how to check their own glucose levels successfully, and she did it well, and then you ask questions like, okay, ma'am, can you tell me what are the signs and symptoms you feel that will tell you that something is not right or your blood glucose is too high. And she's able to mention those 3 P's I mentioned, like polyuria, polydipsia, polyphagia. Polyuria, they are paying everywhere. They are paying excessively. Poly, once you start that's why I started this channel with prefaces. Poly means many, excessive, too much of something. Okay, so polyuria, you are paying too much. And I remember I mentioned urea as urine. If you have watched my previous video on medical prefaces, these are the reason why I started my video with those prefaces and terms, so that you can understand when you see them, because they will not use layman terms for you. You have to get used to knowing your terms, your medical terms, okay? So once she's able to tell you all of those, you feel happy even as a nurse that, it shows all your interventions, your planning, your implementation, everything was successful. And then you ask another question, man, what are the good food that you can eat? And she was able to tell you the good food for diabetic patient, that diabetic patient can eat and maintain a good glucose level reading. And you ask another question, what are the common signs and symptoms you see when you are hypoglycemic, when your glucose level is low? Remember, in my previous, I said hypo means low. Glycemic means sugar. So when you are hypoglycemic, what are the signs you see? If she starts to tell you lightheaded, they're feeling weak, tired, feel like I'm going to pass out, sluggish, dry mouth, all those things. Because a patient that is paying excessively, they are most likely to be dehydrated, right? That's another topic for another day. So this is just to cover your ADPIE. Again, add a pie to my meal. Add. A, write it out to make it easier for you. A means you are in that assessment phase, you are gathering data. D, that's when your nursing diagnosis comes to play. This patient, you already know what's going on now. P, that is when you are planning, you are gathering, you're having a goal, you are communicating with your patient. Man, we're going to work together and we're going to get a good goal. And this is what our goal will look like. I expect you maybe in the next 24 hours of admission, you should be able to check your own glucose level, things like that. And in your implementing phase, that's when all those treatments are getting into actions, giving insulin, teaching, giving medications, and all of that. And the last but not the least, you're getting your evaluation phase. This patient is demonstrating back everything you've taught. And as a nurse, you're going to feel so proud of yourself because you have done well by teaching your patient through this whole process and achieving your aim. So thank you. If